Mr. Dennis Tan.
Question 12.
Mr. Speaker, over the last 2 decades, more than 6,000 SAF personnel have been deployed for overseas operations. Only one serviceman was diagnosed to have developed PTSD or post-traumatic stress disorder after his deployment. The incidence of all psychological disorders amongst SAF personnel on overseas deployment is not higher than SAF personnel in general, nor or the incidence amongst the general population. The low rate can be attributed to the selection, pre-deployment training, and mental health support system in place for our servicemen. This includes physical preparation, psychological screening, briefs on threat assessments, job descriptions, and security procedures, as well as avenues available to contact their family members or seek help for personal matters while overseas. The IT connections, despite being in remote areas such as Iraq and Afghanistan, are good, so SAF personnel are able to speak to their family members frequently. On their return, all personnel undergo an assessment of their psychological well-being for early intervention by counselors, psychologists, and psychiatrists if necessary. Compensation for psychiatric or psychological disorders follows that of the overall framework for injuries and disabilities arising from service. Consults and treatment of affected personnel are fully subsidized at government-restructured hospitals, clinics, and community hospitals as long as required, even after his term of service. For servicemen whose disorders were due to service but manifested after they have left the SAF, they are also eligible to the same terms of treatment.